Hi everyone, Norma Jean here. In my last video, I talked about our Western diet as the major disruptor that harms our microbiome and leads to dysbiosis over time. I also explained the process of dysbiosis, when harmful microbes overwhelm good bacteria, leading to leaky gut and inflammation. Today, I want to discuss other categories of disruptors, including medications and drugs, lifestyle and environmental factors, as well as genetics. Medications and drugs are a category of microbiome disruptors, with the worst being antibiotics, since they wipe out the bad and the good bacteria in our guts. Yes, they are essential and life-saving in some cases, but too often we choose to use them when our own immune system is fit for the job. I definitely fell into this trap before I learned about the microbiome. I was told to take an antibiotic before delivering my first child because I had strep, only then to deliver a baby that had colic and thrush. As she grew, she was getting frequent ear infections, and I was advised to give her antibiotics repeatedly by her pediatrician. It wasn't until I studied the microbiome and its connection to immunity that I had discovered she had developed leaky gut and an intolerance to wheat and dairy. Long story there for another time. Fortunately, pediatricians are more cautious about prescribing antibiotics, but we need to learn that there are alternative solutions out there for all ages. Another common disruptor of the microbiome are protein pump inhibitors, or PPIs. These reduce stomach acid to relieve acid reflux, but they also disrupt proper digestion of protein and allow more harmful bacteria from the mouth or food to pass into the intestine. In fact, chronic use of PPIs is associated with small intestinal bacterial overgrowth, or SIBO, which is an overgrowth of bacteria in the upper intestine where it does not belong. There are many other medications that can disrupt the microbiome by harming good bacteria, including aspirin, antidepressants, laxatives, and more. It is important to pay attention to gastrointestinal symptoms and bowel movements when taking meds. Alcohol is another disruptor that contributes to dysbiosis. The main fermenter of most alcohol is yeast, which can overwhelm good bacteria if consumed too much or too often. Smoking and vaping are additional disruptors that cause more harmful growth in the oral cavity, which can travel down into the intestines. Certain lifestyle factors can also harm the microbiome. The biggest is stress, which is a major disruptor on its own. Stress alone can cause increased inflammation and leaky gut, contributing to immediate gastric discomfort or leading to irritable bowel syndrome, or IBS, or inflammatory bowel disease over time. Lack of sleep is also a common issue that impacts the microbiome, since gut bacteria actually follow a circadian sleep rhythm as we do. If our gut does not get rest, it does not have the time to clear the clutter, and your digestion will show it. Think of how many times you were sleep deprived and experienced gastric discomfort along with it. Of course, infections from food poisoning or exposures while traveling can also throw the microbiome off and have long-term effects if not corrected. We are seeing this with long-term COVID, in which people are experiencing chronic gastrointestinal problems and compromised immune systems. Environmental factors that affect the microbiome include everyday products such as antimicrobial sprays, gels, and soaps. Our fear of germs does not allow for small, important exposures to develop a healthy immune system. In fact, the CDC has a term for it called the hygiene hypothesis, which is a partial explanation for increased allergies in kids. Small exposures are especially important for children, yet I followed the fear with my firstborn and used antimicrobial gels often. I even recall an elementary teacher that pumped antimicrobial gel into the hands of each student as they came in from the playground. She had good intentions, but you don't know what you don't know. Unless you are working in a hospital system, washing with warm water and natural soap is best. More time indoors is also a problem when time in nature is limited and we miss exposures to a natural balance of microbes that are good for our microbiome. In fact, studies show that kids growing up in the country or on a home farm have fewer cases of allergies or asthma, which is connected to gut health. A final major influence on the microbiome that I will cover today is genetics. Some people inherit genes that compromise their ability to clean out bad cells in the intestine. Hence, they will experience imbalances more easily. Others might have compromised genes that affect mental health, which can cause more stress and anxiety that directly cause gut disturbances. In both cases, the health of the microbiome becomes even more important. The number of things that can affect our microbiome can become overwhelming. This does not mean we need to eat and live perfectly, since our gut microbiome knows how to bounce back. However, it is when we constantly overwhelm our gut that it gets thrown off the edge and we experience mental health and physical health problems. Even so, it is possible to bring the gut back into balance, and I will discuss this in my next video. Until then, be well.